Today I'm going to talk to Holly Harris, who is a nutrition behavior scientist and accredited practicing dietitian from Brisbane, Australia. She has a Bachelor of Health Science and a PhD in Nutrition and Dietetics from the Queensland University of Technology. She did a postdoc at Penn State on ingestive behaviors and appetitive traits and worked on the Insight project for 2 years with Leanne Birch. Currently, she's working on a postdoctoral research fellow at Erasmus Medical Center in the Netherlands, funded by a Horizon 2020 Marie Curie grant. We're going to talk about a very interesting subject, which is autistic traits and food fussiness or food selectivity. So we welcome Holly to the podcast.
Hello, everyone. It's so good to have you all back here on Alimentos y Emociones podcast. Thank you so much for returning. And today I'm really excited to have Holly Harris with us. Hi, Holly. How are you?
Good. Thanks, Claudia. Thank you so much for having me.
It's so cool to be able to join up with, people I know and people I don't know. And I've had the pleasure of meeting you several times. So at least I feel like we're in, sort of closer company. And it's so good to be able to talk to you about, the work that you've been doing and also this subject and this topic, which I think will be really interesting to a lot of, the listeners or the viewers on the YouTube channel. So we're going to talk about autistic traits and fussy eating. So, wow, what a topic. Well, what a topic. But before we get there, we're going to start off, and I'm going to sort of start with my usual question, which is, the good thing is that you're a dietitian. So I feel like we're, sort of buddies there, because a lot of people sort of, think that I interview a few too many psychologists, probably, for someone who's a dietitian herself. So how did you start in this area of eating behavior?
Okay, well, I always wanted to be a dietitian. I think from being a very young teenager, maybe 14, I was so interested in food and eating and nutrition. And then I was doing my nutrition and dietetics degree at Queensland University of Technology. And in my final honours year, I had a research project. And that research project was with another person that you had interviewed in your podcast, Kimberly Mallon. She was supervising me on the Nourish randomized control trial work. We had a little side study of looking at eating in the absence of hunger. So I was involved in helping Kimberly design this eating in the absence of hunger protocol, where we would go to these children's houses and we would feed them lunch and then a bunch of snacks afterwards and see how much they ate. And my particular project was looking at eating in the absence of hunger and how that was related to maternal feeding practices. And I loved this research project so much, and I had such a great experience. I had 1 year of doing clinical work after I graduated my nutrition and dietetics degree. So I worked in Outback Australia,
Wow.
And I was doing dietary counselling with all different types of communities. And that was just such an amazing experience. But I just noticed that when I was doing this nutrition counseling, I would talk to people, I would give them the information, and a lot of it, generally people know what to eat. They know, what they should have more of and what they should have less of. And I really felt like one of the things that we weren't addressing in that consultation room is eating behaviors and kind of the approach to food and understanding why someone might, not be able to stop eating whenever they see food, or some people are fussy with food. I really wanted to get in kind of like the mechanics of why we eat the way we do. So that kind of brought me back to research. And so that's when I started my PhD. And actually, Kimberly Mallon was one of my supervisors as well. So that has led me to, lots of different research projects and to where I am now.
Well, I think that, all of us who are interested in the sort of psychological side of eating as well, and the behavioral side of eating, end up having some of these questions and end up doing PhDs in these areas. And that's why, But how did you, when you started doing your PhD, what was the topic that you were working on then with, Kimberly's group and Lynn Daniels' group? And
yeah, so yes, Lynn Daniels was also one of my supervisors as well for my PhD. And I think one of the things that really drew me in as a topic was child fussy eating behaviors, because at the time, and it still is, I guess, child obesity and preventing child obesity is still a really hot topic, and it's still a very important one. I wanted to approach this childhood obesity topic from a different angle. Instead of focusing on, reducing weight or preventing obesity, I wanted to understand how we could increase children's intake of fruits and vegetables, because that's the really, difficult foods to get a child to eat. So I wanted to understand how we could, make the feeding process a little bit easier for families. How can we understand how parents can feed healthier foods or feel like they can feed healthier foods and promote healthy foods from that angle rather than reducing, snack food intake or the like. So I was really interested in tackling this subject. And I also thought it would be a stealth way to talk about nutrition with parents and children, because I think that, as soon as you mention childhood obesity, parents might balk at that. But talking about fussy eating, parents are happy to talk about fussy eating, whether they have experience with that or they know another family who has a fussy eater. I think it's a really hot topic just from my perspective as well. So that kind of led me into my research with fussy eating. And my PhD was mainly focusing on how parents feed fussy eaters, how they respond to fussy eating.
Actually, that sounds really good, because there's this whole movement as well of not restricting eating. There's the restricting eating section side, and there's, at least I've found now since I've been back in Mexico and with the whole dietetic, a big bunch of the dietetic community, where it's let's stop talking about restriction. Let's stop talking about what you should eat and what you shouldn't eat, the good, the bad, and all these classifications. So actually being able to talk to it from the fussy eating point of view, as opposed to, no, you can't eat this, or no, you can't do that, or you should eliminate this, actually gives you, I hadn't thought about it that way, but it's a really good way of doing it. It gives you a really good sort of entry way. So what did you do? Because then you did all this stuff with fathers and, I think that's really interesting as well. Maybe you'd like to guide us through that work.
Sure. So my PhD really centered around fussy eating and how parents fed fussy eaters. I kind of had two components. One was looking at a group of parents and their children, preschool-aged children. And in this study, I named it the Mums and Dads, or MAD for Mealtime Study. I wanted to look at how both mums and dads fed children. So I recruited mums and dads of preschool-aged children, and I wanted to look at two-parent families. So we're limited to just generalizing about two-parent families. And I was interested in dads because we haven't really talked a lot about them in feeding. And we know that, even if they're not involved from, just sitting with children at mealtimes, or they might not be involved in feeding children, they definitely can have an influence somehow on child eating. And so I was interested in mainly how both mums and dads respond to child fussy eating. So another part of my project was also the Gemini project. So this is where I met Claudia. I was really lucky to work with Professor Jane Wardle. I had a scholarship to go to UCL and work on the Gemini study. And I published a paper with Claire and Ali Fields, also looking at fussy eating and parent feeding practices. So I guess first I'll talk a little bit about the MAD for Mealtime study. One of the most common things that parents do when they're responding to child fussy eating seems to be pressuring a child to eat. So trying to get the child to eat the whole plate, finish the plate, one more bite, to have a no thank you bite. And another method is to use food rewards. So that might be, okay, if you finish your plate, then you get dessert. Or you have the the fruit and vegetables, and then you can get a sweet or something like that.
Nicely conditioning them to emotional eating.
Yeah.
We nicely push them in that direction. Yep.
Yeah. And a problem with these feeding practices is that we think that they could be teaching children to eat for reasons beyond hunger. So, for example, emotional reasons, or they might be, eat for reasons that aren't related to hunger and satiety. So the thing is that we want to discourage parents from doing this, and yet it seems to be quite a natural response to child fussy eating. In the Mums and Dads for Mealtime study, we found that mums and dads who were on the same page with avoiding those pressuring feeding practices or avoiding this reward for eating, they had children who reported to be lower in fussy eating. So although this study was a cross-sectional study, we can't really tease apart causality here, but it definitely indicates that having parents on the same team when it comes to feeding a fussy eater can't be a bad thing. Yeah. So that was kind of one part of my fussy eating experience. And then the other part was working with the Gemini study. So this was a very different approach where we did a discordant twin analysis. So what a discordant twin analysis is that we look at differences between two twins on a particular trait, so fussy eating, for example, and see if parents responded differently to children who were different in their fussy eating. So the reason that we looked at this was because there is, I guess, a long-standing theory that parents were to blame for their child's fussy eating, that they caused these fussy eaters. And Professor Jane Wardle was actually the one who had a hunch about, well, it actually could be parents responding to differences, innate differences in their child's eating behaviors. So with Claire and Ali, we tested this theory, and we did this with the discordant twin analysis. Mm-hmm. So when twins differ in their fussy eating, we know that, we know that fussy eating is highly heritable, but also twins kind of act as their own control for environmental, for their environment. So for example, they have the same mother and they had the same womb, the same prenatal environment, and they likely had the same diet early on and the same environmental exposures and socioeconomic status. So we can kind of control for those environmental factors and see that if there are differences in child fussy eating, is it related to differences in how parents might feed both of the twins? So this suggests a more child responsive model rather than a parent driving that association. And indeed, we did find that for a fussier twin, mothers were more likely to report pressuring feeding practices, but also these rewarding feeding practices as well. So using food as a reward to get a child to eat. And these are typically practices that encourage food intake rather than the restrictive food intake.
So that's really interesting, because you've got these, these twins that are behaving differently. And you think they should be behaving the same. It must drive parents completely insane, to have one that is actually eating and the other one not. And yet you do actually do things like, you do the most extraordinary thing as a parent when you have a fussy child. You don't, even with the knowledge, even as a dietitian, and with the knowledge, all you want is you want them to eat. And as a dietitian, this is just by the way, but, as a dietitian, you feel even more guilty, because it's like, you should know. Or if you're not a dietitian or you're someone in the behavioral field, you should know that you shouldn't do this. But, how can your child be the one who's not eating? It's like, it's an affront to your professional life, basically. So not only does it tell you that you're a bad mother, it also tells you that you're a bad professional. So it's like a double affront. It's it's hard work, actually, I have to say.
Yeah, and I think it's easier said than done. You know, it's easy for me to talk about this, but, you know, it put me in the situation, I don't know what I'd do. I'd be tearing my hair out. And I think that this is kind of a main message of that fussy eating is quite a normal developmental phase. And I think that maybe we need to start talking about it and normalizing it for parents to kind of decrease the guilt, because it doesn't help the feeding dynamics at all, and it doesn't help mother or father. So that's kind of one of the things that I'm looking at now, is a bit more of this, I guess, more enduring and persistent fussy eating, which we typically see in children with autism. So, so I think that kind of messaging and figuring out, this is actually research that we should probably be doing more of, and that I would like to kind of move the field forward a little bit more in, is understanding what is normal fussy eating, and what be something that parents may actually need to worry about, or actually need to seek, you know, further help from health professionals from. You know, and seeing that if we kind of just, you know, leave these children who have the normal, typical fussy eating behaviors, you know, eventually they're going to learn to like a variety of foods depending on what the parents eat, but they'll probably will also have their own food preferences as well. But potentially on the other end of the spectrum, there are some eating behaviors that we need to be a bit more cautious of, and that might require some more intervention.
Okay. But the interesting thing here is how much does that mix with actually, you know, having some form of autistic disorder? I don't even know whether I'm saying it the right way, and probably not. So I'm excusing myself from the beginning. How would you, you know, do they go hand in hand, or would you have to have some form of spectrum disorder in order to have this sort of like fussier, slightly more pathological? Am I going in the right direction? Eating?
Yeah.
What's going on there? Maybe you'd like to tell us all about it, because I'm curious.
Sure. Well, this is the research that I'm doing right now. So I'm working at Erasmus Medical Center in the Netherlands with Professor Pauline Jansen. And so I've been here for about 2 years, kind of figuring out, also in lockdown, figuring out this relationship between autistic traits as they exist in the general population, and fussy eating on a continuum. So both of these traits on a continuum. So the way in which we're looking at this is through the Generation R cohort study. So this is a cohort of around 9,000 mothers that gave birth to children in Rotterdam, the Netherlands. And the children and the mothers have been followed up from prenatally, and then now about 18 years old. So there's lots of different time points to look at developmental changes and how these measures change over time and might influence each other. Typically, research that looks at children with autism, they might just compare children with autism to those without, and compare factors like fussy eating or diet quality. But we have really little evidence of autistic traits as they exist in the general population, which they do, and how this is related to things like development of fussy eating or diet quality or other factors like weight. So we know less about these two kind of, I guess, phenotypes, which might be closely related to each other. And this is kind of what I suspect is happening, that these are phenotypes that relate to each other. So just because a child might not have diagnosed autistic traits, they might still have elevated autistic traits. And we know now from my research that this is actually quite related to fussy eating in the population or food selectivity. So there seems to be a relationship there.
Right. Yep. Okay. So yeah, that's the first sort of section.
That's the first section.
But obviously not everyone with an autistic trait is also a fussy eater.
Absolutely. Yeah. The thing is with autism, and it's really, you know, you have to be cautious about making these statements about autism, because if you've probably heard the saying, if you've met a child with autism, you've met one child with autism, and that it is quite a heterogeneous condition. So these traits are more likely to be kind of measuring just facets of autistic traits, and they could be things like socializing, or it can be things like developmental delays. So these are kind of maybe indicators for autistic traits, but they might not necessarily mean that the child has autism.
Yeah. Okay. And then how does the sort of fussy eating present itself?
So before, when I was talking about how we have many different measures of following up children with, we have measures on autism, autistic traits, and also eating problems or food selectivity.
Yeah.
So the project that I'm working on has two aims. One is to look at how these eating problems and autistic traits co-develop over time. And the second part is to understand fussy eating as this mechanism which might be explaining why children with autism or elevated autistic traits have poorer diet quality and have gastrointestinal issues like constipation. So, well, firstly, one of the analyses that I've done uses this really cool statistical modeling technique to kind of pull apart. I'm going to nerd out for a minute.
Good. Go for it.
To pull apart these kind of repeated measures that we have of each child and see what these between differences are. So these like between differences effects of autistic traits and eating problems, and see if there is some bidirectional kind of like causal associations between autistic traits and eating problems. And what we find is that from the ages of 1.5 to 14 years, where we have 5 time points of measuring these repeated measures, we find that children who have higher levels of autistic traits also have higher levels of fussy eating over time. So this isn't surprising, and gives us evidence for a bit of this like phenotypic cluster of these behaviors. But also what we do find is that once we control for this between person effects, we can look at the differences within a person. So comparing a child's average level of autistic traits to their subsequent average level of eating problems. And basically what we find when we pull this apart is that there seems to be some evidence for a bidirectional association between eating problems and autistic traits in the early years. And this kind of fades away as children get older. So a couple of things might be going on here that I should caveat. One is that it doesn't necessarily mean that eating problems are causing autistic traits and autistic traits are causing eating problems. But certainly it seems to be that a higher level of autistic traits seems to be followed by a higher level of eating problems, and also the reverse.
Yeah.
But this could also suggest that potentially there is a sensitive period for intervention, and that could be in the really early years. And whether that is, you know, using eating problems as a potential indicator of autistic traits, elevated autistic traits, where we can intervene earlier in that progression of autistic traits. But also, just getting some help early on could be, you know, the best thing to kind of set a child on a better developmental trajectory. So we need to find out a little bit more about that.
Okay. I mean, that I might be jumping a bit ahead of my time, a bit ahead. But what do you see as like how would you sort of say treat just your normal fussy eater, you know, and where do you see this line going towards more of this, you know, more difficult fussy eating that you were talking about at the beginning when you started to, you know, outline the work that you're currently doing? Does that make sense? So where is like is there kind of like levels of pathology in their fussy eating? And what,
Absolutely.
you know, as a professional, how do you help a mother who just has a fussy eater? And then how do you help a mother who has a, you know, fussy eat, or mother, father, anybody, you know, who has a fussy eater and has, for example, autistic traits? What, you know, what kind of intervention do you need there? And I know that hasn't been your work, but obviously you have ideas about it.
Yeah, I'll start with the I guess the normal fussy eater, and by the way, maybe you could like link this in the show notes.
Yes.
But I actually wrote a an article with this in the conversation with Dr. Rebecca Byrne, which is how to understand if your child's fussy eating is normal. Yeah. And so there's some kind of like tips for parents there, and if you're
definitely, I'll put that link. That's would be really important.
Yeah.
Yep.
So I think it depends, you know, I'll answer this from a dietetics perspective, because I think when a child has, you know, normal quote fussy eating, that it depends on, you know, if there's any kind of any like impacts on their daily life, whether it affects like the child feeding. I think that intervention has to be tailored to the type of fussy eating that a child might have. So they might be excluding a whole food group, or they might just be, you know, eating a small amount of food. But this could actually be quite normal depending on the child and their age and their growth. So the way that I would suggest helping or assisting a parent in helping a child with maybe more of the normal, typical fussy eating is firstly to not worry and to continue repeating exposure to a variety of foods, even though a child says no. So there is, you know, some evidence that repeat exposure, you know, up to 15 times of one particular food is enough to let a child decide whether they like to eat it or not. And of course, like every other person, children also have preferences for foods. You know, some foods they like and then some foods they don't. As long as it doesn't seem to be impacting growth or other psychosocial impacts, then eventually you hope it's something that they grow out of, and that parents, we should just really support them in not worrying about their child's fussy eating. And, you know, and maybe not label their child as a fussy eater, because this can kind of, you know, make a child identify with that fussy eating.
Yeah.
On the other end of the spectrum, we have a fussy eating disorder that's now in the DSM-5, so the Diagnostic Statistic Manual for Psychiatric Disorders, and that's Avoidant Restrictive Food Intake Disorder, or ARFID. And to meet this criteria, you know, fussy eating seems to be within the history of a child developing this disorder. But we also know that this disorder is related to autism and other psychiatric conditions like obsessive compulsive disorder. So there seems to be a constellation of disorders here. Children with ARFID tend to present with a decrease in growth. So they might not be putting on enough weight, or they have growth faltering. They dip across percentiles in their growth. They might be excluding whole food groups and have nutrition deficiencies. But this might be affecting their nutrition deficiencies, might be affecting their socializing, their hobbies, their ability to learn. So these are kind of a bit more, I guess, stringent criteria, and, you know, at that very severe end of the spectrum where a child is not eating enough. So so there is a huge variability between, you know, the typical fussy eating and something that parents could be, you know, very concerned about. So of course,
proper pathology, I mean, that, you know, properly described in the DSM. Yeah. But again, I mean, how do you work with that on a dietetics level? Because that, you know, that's very different to repeated exposure, basically. I mean, obviously, would you try repeated exposure as well as the method? Yeah,
that's a really good question. So I have worked with actually, during my time at Erasmus Medical Center, I've done some observations of children with autistic spectrum disorders eating, and they work with lots of psychologists, but actually there's not a lot of dietetic intervention. And I think because potentially that might be the first step is looking at these kind of aversions or the reasons why a child might be rejecting food. So that could be a number of reasons. One is the sensory sensitivities, potentially that they have elevated or heightened senses to textures or smells or the appearance of food. Sometimes children can fall into this really severe end of the spectrum of fussy eating because they have aversions to food. They could be worried about swallowing foods or had a history of choking or vomiting. And then there's also children who have a lack of interest in eating. They just might not enjoy eating. They don't like it. They don't really feel hungry. So why would they eat? So I think it really depends on the kind of underlying reason for a clinician to then approach how they might handle this. And I think that having the multidisciplinary team is really important in this approach. But yeah, I can't give you a straight answer about a dietetic approach. I think that it's done in consultation and depending on the case.
I would think that the multidisciplinary team would be really important, because it's a bit like, you know, eating disorders in general. It's like, oh, you've got a problem with your eating, send them to the dietitian, and nothing could be further from the truth, because as dietitians, that's not the underlying problem, but, you know, in the eating disorder either. So, you know, we're kind of like, we have to help them with their eating, but the reasons why they eat or not eat are not necessarily, you know, nutrition related, basically.
Yes.
And that's why they are in the DSM-5, you know, as psychiatric disorders, basically.
Yeah.
And I think that's important to point out, because, you know,
and dietitians have a really important role in just identifying where there might be deficiencies and suggesting foods. But I think it's the same with even just typical fussy eating. There seems to be a need for addressing behavioral elements of why a child might be fussy, because maybe there are reasons behind it that can be addressed, or that we can just try different things. So maybe parents need ideas for different foods that a child might be more willing to eat.
That is really good. I think you've covered quite a lot, and thank you for that. I'm curious, sort of like where life is taking you next, because I think that pretty soon we might have to have you back talking about the next sort of set of work that you'll be doing. I don't know if you're ready to say that yet or not. Have I put you on the spot?
I don't think I am.
Okay.
Yeah, I don't think I am. Just
we'll
because,
like, we'll have you back.
Absolutely.
But about other topics.
Great. That would be amazing.
This has been really, really helpful, I think. I don't know if there's anything else that you want to add to this that would kind of like, you know, I don't know, or not necessarily, but I think this is really interesting. It's a new, well, it is to me anyway, newer topic and new subject, and the research that you've been doing is really interesting, Holly.
Well, one of the papers that, I don't know how much time we have, but one of the papers that I wanted to mention, and I know that you and I talked about this a couple of weeks ago, is I have been looking at the relationship between autistic traits and diet quality. And we had, you know, as dietitians, we have this kind of need to quantify everything. We want to like count the macronutrients and the micronutrients. And honestly, this is why I got into nutrition and dietetics. But after time, you realize that people eat food and not nutrients, and that it's not so easy to just count everything and just see how much protein and fat. And, you know, I think that that's kind of the approach that I've taken with this research looking at autistic traits and diet quality has been to look at more food groups, because I think that this is more useful for clinicians to be able to give advice for eating.
Like
So
dietary patterns more than food, more than macronutrients.
absolutely, yeah. So one exciting finding from this research was that we saw that children who had this elevated level of autistic traits from 1.5 to 6 years were more likely to have lower diet quality at 8 years old. And this was mainly explained by lower intake of fruit and vegetable, which isn't so surprising, but also fish intake. So these are maybe some foods that early on, if a child is displaying elevated autistic traits, that maybe that can be foods to work towards or something to integrate in a safe way into a child's diet. And of course, this is explained by fussy eating. So this is kind of like I guess more of I'm trying to push for both a diet and a psychological behavioral approach when working with these children and parents as well.
Yeah, that yes.
Yeah. Do you have anything to add about the diet quality and the diet patterns?
Well, I've very much sort of grown sort of like away from, I can't deal with the, with the sort of macronutrient counting stuff. It just, I've kind of lost my interest in that in a way.
Yeah.
I really, really like to understand sort of more like dietary patterns. I just can't understand why we were so obsessed in measuring, the percentages of things when what we eat is food. So
yes,
it makes a lot of sense that there's this relationship between sort of fruit and vegetables and fish, because I would think that maybe not so much fruit, but vegetables and fish would probably be some of the things that you would find the most difficult for children to eat anyway.
Yeah.
So
looking
at a sort of group as opposed to, just like so much protein or so much fat or whatever.
Absolutely.
It just makes sense to me. It like on a practical level as well, not only as a dietitian, but also like as a mother, like when how you give food to your children, what you give to them, how you present it. It's food. I don't think in terms of has it got enough protein or, I do in general because I know about it, and I was trained that way, but I'm not so worried about whether I've got the percentages right. But I am definitely worried about a combination of foods.
Yeah.
Does that make sense? And it helps me guide like either like the way I would feed my kids, but also how I can help, parents with these issues and their children. So I'm glad you brought that back, that that conversation that we had back, because I really think that it's important that we think in those terms as well as dietitians. And like you say, let's mix it up with the eating behavior and understand the eating behavior, not just leave it to just solely to the dietetics part, because I don't think it's going to answer the questions,
Yeah, absolutely.
Or address the issues. I don't know whether that was a bit too long-winded, or what do you think of that?
No, I completely agree. And I think, I know that my area of research of looking at autistic traits might seem a little bit narrow in this conversation, but I feel like there's probably a lot we can learn from these kind of like why children might be rejecting fruit or vegetables and fish. These are the foods that have less consistency when you present them, the ripeness of a banana or like, the freshness of a fish. Like potentially we could learn a lot from these children who have elevated levels of autistic traits to see why children might be qualitatively rejecting these foods.
I like the bit
Taylor advice.
I like the bit about this, the like being so highly sensitive to the flavors or to the smells or to, and like you just think of the people that and how we all eat. maybe we do all carry that into our life without having, you know, a particularly sort of, you know, autistic traits. But maybe we do have these high sensitivities to certain foods, you know, from our prenatal environment, from all sorts of things, you know, what our mother ate and what, it's a fascinating subject. And I'm really glad that you put this on the table here, Holly. Thank you. Thank you so much for sharing your work with us. This is really good. It's now made me think of, like, you know, all sorts of potential work that can be done as well with.
Nice. It's been such a pleasure to chat to you.
Well, thank you, Holly. And it's great to see you. And hopefully I will get to see you soon in person.
That'd be great.
It's looking that way, like we might be able to sort of start moving a bit. I really want to say to everybody that I appreciate, you know, everybody returning to the podcast, listening to these episodes. I feel that if you have something to say, please, you know, remember to give a few stars and, you know, put, you know, thumbs up and leave your comments, because that way the podcast actually gets sort of known a bit more, and it maybe can be, you know, the word can be spread and used by, you know, students and people interested in these areas, and we can all share these topics that are really interesting. So thank you all for returning. Thank you, Holly, so much for coming on, you know, the episode, the podcast, and for sharing this information with us.
Thank you.
And I'm just going to say what I say at the end of every session is, like, you know, we continue to nourish each other with all of this information. So thank you all for coming back. And we'll see you on the next episode. Thank you. Bye.
Nos vemos en un próximo episodio de Alimentos y Emociones Podcast. Y recuerda, nos seguimos nutriendo.